Hi friends, it's Quenby Gallahan, the Grateful Therapist here on YouTube. Welcome back for another video. Today's video, I'm going to be talking all about how I use body drawings or body mapping to help my clients understand and control their anxiety. If you're new to this channel, welcome. I'm so glad you're here. I've been a licensed marriage and family therapist here in the state of California for over a decade, almost 15 years. I work with children, adolescents, and families. I've been doing it for quite a long time, and I share all about it here on this channel. So if you like learning about mental health, counseling tips and therapy tips, and personal growth, please be sure to subscribe and turn on the bell so you know when my next video comes out. Today I'm going to talk about how I use a very simple body drawing outline or template to help clients understand how anxiety feels in their body so that then they can recognize it sooner and use the helpful coping skills and tools that their therapist or counselor has taught them to use to deal with worry, anxiety, panic attacks, anxiety issues. Most of us know that one of the best interventions that we have to help our clients with anxiety is education. It's really helpful for our patients to understand how anxiety works in the brain, in the body, in our thoughts, in our whole systems, so that they can learn to manage their anxiety better. One of the first things I do is offer education about how anxiety works and make sure that the client really understands. This is such a powerful intervention. So I usually take out my brain diagram and I point out that little almond-shaped part of the brain called the amygdala, and that's a part of the brain that is responsible for helping us prepare in the event of a real emergency or a crisis. It controls our fight, flight, or freeze response. I offer education to my clients about how anxiety can be helpful in the case of a real crisis or an emergency. It's a very important job that this little amygdala does for us, but some people have a very sensitive amygdala and it's giving them signs and signals to prepare for emergency or crisis that isn't really there. It's not really happening. There is not a wild animal running out of the jungle about to get us. So we do not need to turn on our fight, flight, or freeze response. Some of us need to manage that response a little bit better. That little part of our brain, that amygdala, when it perceives a real danger or threat, it floods our body with the hormones that we need in order to stay there and fight if we're in a dangerous situation, to flee or run off if we need to, or to freeze and not respond if that is the safest thing for us in a given situation. So it's a really healthy, important part of our brain. But some people have an overactive amygdala. They are perceiving threat and danger where there isn't really a genuine threat or emergency happening. Sometimes it feels like it is, but that's one of the things we need to remind ourselves when we feel that flood or wash of hormones through our body. I know it feels like I'm in danger here, but I'm not. So using education to help our clients understand what's happening to them when they feel that anxiety come on or that panic attack come on, and it feels very real for them. It feels physical because indeed it is. The amygdala in your brain has sent out a red alert that there is something of danger here, and it's sending out hormones through your body, and that's why your body's reacting the way it is. But if you can catch the very first signs of anxiety in your body, you have a better chance of preventing an anxiety attack or a severe episode of anxiety in some way. You have more control over it. So I like to teach clients how to identify anxiety in their body, and I use a body drawing or outline to map this out with them. I do have a body map template available, as well as some samples and a description, explanation of how I use body drawings. Those are available for you. There's a link in the description below to my Etsy shop. That's where I put all my therapy tools that you have asked for. Many of you have asked for the teen question cards that I use when I'm working with teen clients. So those are available in my Etsy store. I have my anxiety flashcards. Any of the tools you've asked for, I've made available. It's a great way to get my tools to you that you've been asking for. So there's a link to my Etsy shop that'll have this body outline and instructions and anything you need if you want to try this in your practice. Let's go over to my art table. I love using art interventions with therapy clients for so many different things. So let me show you how and where I do that in my office. So what I often do is I have markers, colored pencils, any type of art supply, crayons, pastels available. And then I ask a client to tell me about a time that they were recently feeling some anxiety. And pay attention, what did it feel like in their body? And what you're usually going to get, almost all the body drawings end up looking the same. What you're usually going to get is something like this. I'll tell them to use lines, colors, shapes, anything. They don't have to be a good artist. Just to map out kind of what they're feeling in their body when they imagine themselves in an anxious situation. And you'll usually get something like this, some variation. And it's a great opportunity for education on anxiety once again. So people often say they feel like their heart is racing or beating so fast, or else there's the tightness there. They'll feel a lot of energy in their hands, maybe their feet and legs too, like they want to punch something or they want to run. Their thoughts are just going super fast. And I explain to them that this is a very common experience in the body when they are going into a fight or flight response. The reason they feel this way is because the body is releasing all these stress hormones that are necessary to prepare you in the event that there is a real life emergency. If you're out walking and a wild animal comes running out of the hills and it seems ferocious and it wants to attack you, you want your body to send out all these hormones because you'll need them to either run away from the animal or you'll need them to stay and fight. So they're very necessary. It's a very necessary body system brain response. However, you often don't need it in the situations in which you're experiencing anxiety. So if they can begin to catch this, these symptoms, the thoughts racing quickly, the heart beating quickly, wanting to feel the energy in your feet and your legs, that they can stop and say, I'm going into an anxiety response. I need to use the tools that I learned in counseling or therapy. I'll often also, when I have this on my template, make a spot where they can write out their thoughts. So they could write something like the thoughts that are racing through the mind, like this dog will hurt me, if they have a fear of animals or dogs. And then we can go over and challenge all of these thoughts as well. Okay, so you can see that using this body outline is very simple, it's inexpensive, you don't need any special supplies, and it's a really effective visual and tool to help educate your clients about when they're going into an anxiety response. And then you get to teach them in counseling or therapy, whatever setting you might be working in, the skills and tools they need. And I have other videos on working with anxiety where I go into this in more detail. And I have some anxiety tools in my Etsy store that you might need as well. But what a therapist or counselor can do is help you to notice first this body response and then to stop and label it. I'm going into fear, I'm going into anxiety, I'm going into worry. And then one of the best tools that we have available to us is breathing. Deep, slow breath. So I will model breathing in the office with my clients and have them actually practice. When we have anxiety, we take short, shallow breaths. We're conserving all our energy for fight or flight. If you take long, slow, deep breaths, breathing in for 3 and out for 3 several times, that sends a message to your brain, hey, wait. Quimby is breathing long, slow, deep breaths. There must not be a real crisis or emergency here because she wouldn't be able to do that if she was indeed in a real emergency situation. So you're literally sending a message to your brain that things are okay, we can start to calm down with those long breaths. And I do model it and have them practice because some people will say, yeah, I think I'm breathing okay, but I want them to actually practice it in the office and at home so that it's a more solid practice so that when they need it because they're having anxiety, they can go right into it. Another thing that is really important with people with anxiety is working with their thoughts. Noticing what the thoughts are that is telling them they need to be afraid, they need to be anxious, and then challenging some of those thoughts. Are these thoughts really true? Are these thoughts helpful in this situation? And replacing them with more healthy, balanced thoughts that are going to help them prevent anxiety and not be so afraid. There are many other tools that therapists and counselors can teach you to deal with your anxiety, but that is just a few basic ones. So I hope this video is helpful to you. Please check out my Etsy shop if you're interested in any of these tools, or if you have any questions, or if you have other video ideas. I like interacting with you in the comments. I answer every comment that I receive here on YouTube, and I would love to hear from you. Thank you.